Well, good morning, everybody. It's a pleasure to be here with you today and to welcome you to Oracle's first Health Summit. And it's very appropriate that we are meeting today in Nashville. Music City will always be the home of country music, but Nashville is the healthcare powerhouse. And Oracle is proud to be part of the Nashville community. So we have an exciting lineup of speakers, and you're going to hear from both high-level perspectives from leaders like David Feinberg from Oracle Health and the CEO of Geisinger, the former CEO of Geisinger, and Eduardo Conrado, president of Ascension, one of America's largest healthcare provider systems. And later this afternoon, you'll have a unique opportunity to hear directly from Larry Ellison, Oracle's founder, CTO, and chairman. Larry has been at the forefront of transforming businesses across many industries, and we will get to hear more about his plans for Oracle Health and Life Sciences. Larry's going to be interviewed by my friend, Senator Bill Frist, and a great American and an amazing human being. Senator Frist has had a fascinating career as a transplant surgeon, a senator, a majority leader, and is the author of some of the most impactful healthcare legislation. And he's now an innovator and creator of companies that are solving healthcare problems and was recently named the chair of the Nature Conservancy Global Board. Both Larry and Senator Frist share a passion for doing big things, and I'm amazed by their energy and commitment to advancing the human experience in so many ways. So while my work in healthcare has been always focused on the problems, I would like to take a moment to express my gratitude for the healthcare system that we have in America. You know, there's a lot that we get right. Our physicians and caregivers save lives and restore hope to patients and their families every day. And our system remains the global source of innovation, producing new medicines to address diseases such as obesity, Alzheimer's, and cancers that plague millions of Americans and cost our economy billions every year. And behind the scenes, technology is supporting every interaction of the healthcare system. And as impressive as such large-scale accomplishments are, it's the one-on-one interactions between providers and patients that remain the heart and soul of our healthcare system. And that's why so much of our work at Oracle is focused on supporting providers and caregivers by reducing the burden of tedious, manual, administrative tasks that often overwhelm them and divert their time away from patients. And unfortunately, these extraordinary professionals work in an increasingly challenging system that relies on out-of-date technology and requires them to make decisions based on misaligned financial incentives that create reactive sick care rather than proactive care to prevent disease and promote health. Our mission at Oracle has always centered around solving our customers' most complex challenges. And especially in today's healthcare world, this is more imperative to us more than ever. And so let me start with the pervasive reliance on out-of-date systems. For almost the last 2 years, Oracle's vast technology resources and expert engineering teams have been heads down, bringing Millennium, the Cerner EHR, to the Oracle standard. Millennium is at the center of our healthcare offerings and will always be a priority that we are committed to. And that means starting with rebuilding the core infrastructure and modernizing the entire technology stack. Because Oracle will not run our applications on 30-year-old technology. And making these investments now will ultimately allow us to deliver innovation faster and at a pace that the industry has never seen. And like we do with all of Oracle's software, we will make continuous upgrades to the core EHR. And that includes improvements to the infrastructure, as well as enhancements to provide a better, more modern user experience. Now, our teams have already published their roadmaps based on the improvements that our providers have asked us to do, and they're delivering them in the timeframes that we've promised. However, Oracle is not solely an EHR company. Oracle's vision is to transform the entire healthcare system to solve the biggest problems, like provider burden, workforce limitations, affordability, quality, access, ecosystem friction, high administrative costs, and lack of value-based care. Just to start with, we want to bring back the joy of practicing medicine for providers. And to achieve this, Oracle is creating a secure, open, interoperable, and connected ecosystem across providers, payers, researchers, and public health. We can't address any of the serious challenges, however, until we first and foremost protect our core, operating systems, and the highly sensitive information they contain. Patients trust us to do that. So the most urgent issue in healthcare today, the one that is at the forefront of government officials and was in the newspapers and on the news this morning, and this is top of mind for every C-suite leader, and that is cybersecurity. So we've all been concerned about this. I certainly was when I ran CMS. But unfortunately, other pressing priorities like COVID took center stage. But not anymore. This is an existential threat to our critical infrastructure and how we safeguard patients. The current standards and tools for protecting healthcare data from cyber attacks are entirely inadequate. There has been a startling 263% increase in cyber attacks since 2019. And according to a recent article in Modern Healthcare, the industry ranked the second lowest in the percentage of total IT spending invested in cybersecurity. As Larry Ellison and I wrote in the Wall Street Journal earlier this month, these attacks are not going to stop until our healthcare systems adopt cyber defense technologies that are robust against the increasingly sophisticated cyber criminals and terrorists. We have a responsibility to make cybersecurity our highest priority. In fact, I would argue, given the impact that hacks can have on the delivery of care, and we've all experienced that lately, cybersecurity should really be considered a subset of patient safety and receive similar levels of attention and investment as other essential patient safety initiatives. Oracle's history in protecting sensitive data, combined with our deep understanding of healthcare, means that our customers can focus on safeguarding the health of their patients, while Oracle can help safeguard patient trust. So later today, during his fireside chat with Senator Frist, Larry Ellison is going to make an important announcement about how Oracle Health is going to step up to the challenge of meeting the cybersecurity needs of our EHR customers. Thank you.